Yeah, I just want to say again that for me to watch all of those films together was a really special experience. Already having watched them and sort of been in the room for parts of the editing process, I'm just yeah, I'm inspired every time I see these people speak. So yeah, I hope you enjoyed them and found them inspiring as well. As I say, I'm really happy to say that we've got some of the people involved in the films coming to speak to us today. So please do keep putting questions in the chat if you have any questions for them. And yeah, first we'll be hearing from Sibongile Tshabalala Mathala, who is the chairperson of the Treatment Action Campaign in South Africa. Welcome, Sibongile, and yeah, thank you very much for joining us tonight.
Thank you, Tim, and thank you for all the people who joined the webinar today. I've been asked to speak about three things, which may be the difference between the 90s and now in the 2000s in terms of the barriers of HIV and the relevance of our struggle today. It is so unfortunate that even though we fought so much, we had so many good examples from the fight of what we've been fighting for different diseases. Even today, we are still having that challenge of we still need to fight. We still have to fight for our lives. We still have to advocate for access. We still have millions of people dying unnecessary because of pharma greed. By this time, we were expecting at least that, the TRIPS agreements will be respected and countries will be able to utilize them. Voluntary licensing we're expecting that it should be something that it's being normalized in every country, especially to those diseases that needs attention a lot. We understand that pharmaceutical companies, they need to make profit, but if you look at the profit that they are doing, is they are still making billions out of people's misery. Even today, I always make example with TB to say TB, it has more than 60 years. We had TB, but up to today, we don't have a cure. People are still dying like flies because of TB, because there is no interest from the
Mm.
pharmaceutical companies. And there is no interest because most people who are affected by TB are in the global south. And uh, it's not supposed to happen. And we don't believe that there is no cure for TB or there is nothing that can be done. TB is just a bacteria that can be dealt with, and there is so much that it can be done, but there's less interest in that. Also, we still have the issue of pricing. Uh, Recently, as treatment action campaign, we were on the street advocating for penicillin pen, which is something, not penicillin pen, sorry, a diabetic pen, which is something that is very cheap in the northern global north, but here in South Africa and Nova, it makes it very difficult for people to access it. And we are saying at least it should be less than $1 a day. It was donated to some few patients in South Africa, but as I'm talking to you now, that donation is over. So people have to go back to the old ways of using the injection, and which they are sometimes they are unable to use the dose. If the person who knows how to inject the person with diabetic is not at home, or the patient has collapsed, then people around that person cannot be able to assist and inject that person at that particular time. So people are still dying unnecessarily. We still need activism, and I believe that we need it more than ever now. And based on the stories that we've listened to and what we heard, we're supposed to be saying we have new challenges, but unfortunately, we still have the same challenges that we had. We still have to unite as activists, scientists, and clinicians in terms of fighting this pharma grid, because at the end of the day, people are still dying. We still need to utilize those courts, legal routes. We still have to go on the street and protest. We still have to have these webinars like this and telling our stories so that we educate others and also be able to advocate. It's not just about telling my story because I want to tell my story, but I'm telling my story because I want to educate others. I want to continue to advocate for people to access medicine, and there's still a need for people to live. There's no money that can buy life. And we cannot be treated as secondary citizens just because we are coming from the global south. We cannot be treated as less human beings because you cannot afford to buy medication. We always, our leaders at the global level, they always talk about equality and inequality. And they are also exercising that because they are allowing inequality in terms of access to medicine to happen right under their noses, because I'm not sure whether they are scared to talk to the pharmaceutical companies. They are scared to take them to court. They always want to push from the civil society, clinicians and scientists before they take action. So with this PEPFAR card funding, Tim, you just said earlier to say UK is also following suit. The past few days, we've been having sleepless nights through Global Fund because they are cutting their funding. And countries like ours, we are depending on that funding, and we have a challenge of that. We have the government that doesn't always realize things early and react early. They are not proactive, they are reactive, and they wait for situation to be worse before they react or they do something about it. I'm talking to you today. Like a few days ago, Global Fund was saying we should cut the budget of our programs by 30%. Today, we are told to cut the budget by 50%
Mm.
with the high burden a country like this. So we have a serious challenge. So what does that mean? It means we are going
Mm.
back to 90s. It means we are going back to where we were. It means all the efforts, all the fights that we've been doing, all the work that we've been doing now is just going to waste just because governments are deciding to do what they do. But also it's a lesson to countries in a global south, because as I'm talking here, I don't believe that we really don't have enough money as they normally say. Yes, we are poor, we are middle income countries, we are lower income countries, but they should put more effort. We should start to invest on our own resources. We should start investing on our own pharmaceutical companies. We need to start, governments needs to prioritize us first more than other things. If you can count me billions of rands that we always lose through corruption in South Africa, that money can be utilized to make our life better. Today I was listening to the other presentation. There's a 1.1 million campaign where the government is trying to get back people who have disengaged to care into care, and we are missing around 1.1 million. You can imagine that number is huge. But having campaigns like that, at the end of the day, we still have challenges of funding cuts. It means we're going to lose more people. So we are trying to make these efforts, but there is these also gaps that are happening on the other side that they don't want to look at and they don't want to talk about. And on the other hand, also people are struggling, people are suffering because there are no services, there's less services. So what I'm trying to say is that we need each other more than ever. We need to unite, we need to work together, we need more activism, especially the civil society space, the NGO space. It's being under attack. because we are losing funding and we are expected not to say anything. Once we say something, we are perceived as attention seekers, as we are making unnecessary noise. That is why I'm saying I feel like we are back to 90s where you always have to fight for our lives. And we believe that this is the time that we're supposed to be at a space where we engage to say, how do we move forward? What are the new developments? But our research in terms of injectables has stopped because of cut funding.
Mm.
Uh, Access to PrEP, it's minimized because of funding cuts, and the government doesn't have a plan.
Mm.
I'm sitting here very frustrated. The government doesn't have a plan. We've been asking for a plan for past 3 months, but nothing is coming up. And we are worried to say how many people are going to die. The projections are saying in 3 years' time, we'll lose more than 500,000 people. So you can imagine how we feel. And it happens while because people or why because people they want to make profit.
Mm.
Pharmaceutical companies, they can take a social responsibility and make sure that we live and provide medication, even if they donate, because they've been making so much money out of all these medicines. HIV medicines, Ebola medicines, every medicines that is there, they are making so much money. They can donate to poor countries if they want to, but also our governments needs to take responsibility and make sure that people continue to survive. And let me stop there before I become emotional, Tim. This is a very sensitive topic for me these days because we are really frustrated and we are scared for our lives.
Of course. I thank you so much, Sibongile. I mean, I think you've put together all of the most sort of the sort of the most terrible aspects of the system and their worst impacts on people, including people in South Africa, and laid it out so clearly and starkly what the stakes are and why we must push back and why we have to win. The stakes feel like they're higher than ever. And I think, as you said, it seems like there's more wealth around than there's ever been, and yet that money is being funneled up into corporate profits, shareholder dividends, and we're seeing more and more cut from services to ordinary people, to working classes around the world, and it's a disaster. We must push back and resist this. So yeah, thank you very much. I'm sure we'll come back to you for questions, but thank you very much for sharing that with us. Really appreciate it. Um, I will turn now to speak to George Poe Williams. So George is a nurse, a union leader, who was in charge of the union that led advocacy during the Ebola outbreak in West Africa in 2014 to 16. And we're really pleased to hear from George as well today. Take the floor, please, George. Thank you.
Thank you, Tim, and good evening, everybody from my side of the world. The reason I'm here tonight is because I am a health worker and I'm a trade union leader who have witnessed the needless death of not only thousands of patients, but also fellow health workers simply because the global system we have today prioritizes profit of a few over the lives of millions. Every time I look back and see how health workers died during the pandemics of Ebola, COVID-19, cholera, and what have you, and I look and see that this is happening because of patent, because there are scientists, there are people, there are companies around the world that are willing to also produce these medications and vaccines and diagnostics at cheaper rate, only if modern technology can be shared with them. So when you look around and see that somebody or some people are hiding behind innovation to use patent when thousands of people are dying in a medical emergency, it is not only uncultured, but it is equally inhuman. And that is the reason why we should all unite and join forces with comrades like our brothers and sisters from Global Justice Now to keep fighting until we can have a just system that will prioritize human lives over profit. Big Pharma must be made to share technology and share the information in their possession because, in the first place, the data Big Pharma is using to produce these vaccines and other technologies before then, it is not produced by Big Pharma. The very health workers who are dying of diseases, outbreak, and Big Pharma and their CEOs will just cheer for them and watch them die slowly are the ones who produce this data that are being used. How does Big Pharma knows that a certain vaccine is capable of curing at this rate? How do they know the efficacy of a vaccine or any medication? How do they know the side effects if there were no health workers to do the clinical trials, stay at the bedside to record the progress of patients and their interaction with the medications, to notice the side effect and record them and be able to share this information? So if they can share this information for Big Pharma, why cannot Big Pharma share her own side of information? What a paradox. But also we know, if not in most cases, if not in all cases, in most cases, the very funding for these researches that can lead to the production of the vaccines and other medications, diagnostics included, are usually public fundings. And for this reason, we should call on all relevant institutions that have that power, willpower to change the narrative, like the WTO, World Trade Organization, to make sure that they take the necessary steps that we allow for the share of technology, especially so during the time of medical emergency. So before I can turn the mic over, please permit me, Mr. Moderator, to speak to one thing that is altogether different from what we are discussing, but it hurts me because I am a health worker and I'm a trade union leader. I'm an advocate for health sector. When I look in Gaza and see how health workers are dying needlessly, people who are going to save lives, just going to the slaughterhouse, it reminds me of what happened in Liberia, Sierra Leone, and Guinea during the Ebola in 2014 to 2016. And I cannot shut my eyes on that. I want to use this time to call on global leaders to look into Gaza and protect the health workers. Their lives matter. There should be every means available to them, medications and equipments to carry on their duties without being hindered. As a trade unionist, we believe that injury to one is injury to all. But as a global campaigner for justice, we know also that injustice anywhere is a threat to justice everywhere. Upon this backdrop, I call on everybody to push harder that we can have patent lifted so that we have the medications we need, but that we wouldn't forget our brothers and sisters who are dying in Gaza. Thank you.
Thank you so much, George. Thank you so much. That's really powerful. And absolutely, I completely echo all of that sentiment. And I think really the way you brought out the way that the pharmaceutical industry tries to convince us that them having a monopoly ownership over the means of production is somehow logical when it's public funding and ordinary workers and scientists, health workers who contribute to the development of these drugs. There's this sense of entitlement, and this story is something that we really have to overcome. And yeah, absolutely. There's nowhere really that needs our solidarity more than Gaza right now. So thank you for those words. We'll turn now to speak to Laura Castro. I'm very pleased that she's joining us from Brazil today. So Laura was involved, or Laura filmed a big chunk of our film on the scientists that we saw at the end of the series. And we're delighted to be joined by her tonight. Thanks, Laura.
Hello, thank you very much. I'm very moved by the film, all the films and the speeches we just heard. So I'm a little emotional. And well, I'll just share a little of my experience doing this film with this great scientists, Brazilian scientists, Patricia and Ana Paula from Fiocruz, which is a big and very important research institution here in Brazil. I have to say that they are two scientists and two women, and as a feminist and a woman, I must remark that, because once I started talking to them, I understood that they started doing this mRNA vaccine like a crazy project, like they say, when they are friends for a long time, and one called the other and say, yeah, I read something about that, let's try. Yeah, let's try. And then they started doing that. One of them with a newborn at home, and the other one with two little children that she had to leave for long periods because we had the pandemics and she couldn't go back home once she was outside at the labs. But that was not for far the biggest challenge they lived while they were working in the vaccine, in the Brazilian vaccine. They had the challenge of our government at the time. We had a far-right government, which was Bolsonaro's president, and he, as all this far-right wings, he didn't believe vaccines, he didn't believe science, and he wanted to cut, as you just said, fundings from our institutions and from our national health public service. And so it was a big threat in all this work they were doing. And yet, when I see this film right now, it's very inspiring, because even though they were fighting the government and their funds were cut, and it was much harder to do everything they did, the institution was stronger and they were stronger and they could fight it. And not only they did the vaccine, AstraZeneca, but they also shared with several countries in the global south for free. And that's a little hope in all this story, especially if we think now that we have like Trump's election in the United States going against human rights and health, and it affects all over the world. And so it's maybe a sparkling hope to how to resist, to how the American universities must be strong, and foundations and research institutions to keep going, because we cannot go back to the 90s, as Sibongile just said. And I'm very moved as well. I was not going to say that, but I'm also a mother of 16 years old. She's going to be 16 tomorrow. A young lady who is HIV positive. Her other mother and I, we adopted her when she was 3, and we never bought medicine. We always got it for free from our public health system here in Brazil. But when Bolsonaro was the president, he had this project to cut HIV medicine from the pharmacies, public pharmacies that give those medicines. And also, it didn't help, but it didn't happen. But I was very, very, very much afraid because we could not afford the medicine if we had to buy it. So I think we are talking here about resistance, and sometimes we are very tired to resist all the time. And it's lives that people that are dying, and this fight that we think okay, now we have free medicine. Oh, maybe not, right? Maybe you're going to go back to the 90s. Oh, now we have this strong institution. Oh, maybe not. Maybe they will cut the foundings. And we are here working, and sometimes we go backwards, and that's tiring. But we must keep going. And this beautiful example of these 2 women, Patricia and Ana Paula, I think are very strong for us. And also, I think this group of films and art in general are a strong weapon to give information, but not only information, also information with sensibility of like somehow touching people's hearts to make something, even very little change, starting inside of people and then outside. So trying to give here a speech of hope, even if it's so hard to think about it, especially if we think in Gaza right now, and we really are in big trouble. But let's think about Patricia and Ana Paula and science and art, and how can we work together to make it happen. Thank you.
Thank you so much, Laura. And yeah, thank you for the notes of optimism. I think the courage as well of Ana Paula and Patricia, and to be honest, of everybody in these films, it's the individual decisions that they've made to do things differently, to stand up when battles have needed to be fought, and to do things in the interest of the common good is personally, I find it so inspiring and galvanizing. And yeah, we certainly are in a very dangerous position. But knowing that these people are out there fighting it gives me hope. And yeah, I really thank you for that presentation as well. That was really powerful. Thank you so much. We're going to hear now from Kat Villiers, who is joining us from London. So as I mentioned Kat in my introductory speech, Kat's provided a huge amount of support for the films. She's an award-winning film producer who's worked on an Oscar-nominated film. She's won the Heart of Sarajevo for her services to cinema. And she also does fantastic work on human rights as well. Laura, I think you might have another device on, perhaps. And yeah, really grateful for everything that you've given to this project,
Laura, I think you need to turn your
It's not me. I'm out. My audio is out, and I don't know who is speaking. I've heard something in Portuguese, but it's not here where I am.
That's really strange.
That's really weird.
Okay.
Be 2 of you, love.
There are 2 of them. There's a real Laura with her picture, and then there's a caption.
And then there's
Laura
somebody else
well.
pretending to be you.
I think it's Big Pharma hacking us.
Yeah.
No, Laura, I think you changed rooms, and your other room is recording.
Yeah.
I can.
Let's see. I'll check my cell phone if something's happening. Just a moment.
Sure. Okay. All right. Thank you, Kat.
Hi. First of all, I just want to thank all the filmmakers who helped make these films possible, and disregard totally Tim's introduction to me because it was not entirely correct. Sorry, Tim. But yes, I am a film producer, and the reason that I wanted to do this was really simple, and it's been said by Sibongile, it's been said by Lara, it's been said by George incredibly effectively, it's been said in a lot of the films, which is this: I'm lucky. I'm lucky. I live in the UK. I don't make films in the UK. I make films all around the world, but I live in the UK. And we have a health service. It's a struggling health service, but it's a free health service. And it is very, very powerful to have that. And I've been ill all my life. So access to medical care is something I care enormously about. And the thing that as Tim and the Global Justice team kept bringing Peter and I more information, the thing that was deeply inspiring and I think the real takeaway for me from all of this, the past is pretty horrible. The present is worse, as bad, let's just say as bad. Trump's cuts are affecting the world. But something amazing happened for me during the making of this, which was simple. I realized that there were all of these extraordinary people around the world who were actually making it work for themselves. South Africa, Brazil, this is, the hub in South Africa and the African and Brazil, where the mRNA was reverse engineered and used for other illnesses. Other vaccines can be created. This is, this is the global South fights back in George Lucas terminology, okay, as in Star Wars terminology. This is amazing because this is how the world should work. It's why we included the polio vaccine right at the very beginning of this, because the polio vaccine was given away for free. It was free to the world. And look what happened. Thousands and thousands and thousands of children's lives were saved. So the point being is we can do it. And as somebody said, we can do it together, but also we sort of have to do it together right now. We don't have a choice. The world's too dark. As George said, when we're seeing the healthcare workers killed in Gaza, and God only knows we've seen too many. We have to all work together. And that's, so do, share these films and share these films. If you can, anybody watching and people who can, I think, Tim, can they find this on Global Justice Now's website? Okay.
Sorry, just trying to unmute myself. Yes, they can. And maybe this is a good moment for Martin to share in the chat where the trailer to the films has been posted on all of our social media channels.
Okay, so and then they can go back to the website and find them. Okay,
exactly,
that's great. So people do share this because this is key. This is such an important. Today it's more important than it was even at the time we made these films, but because it's getting better and it's getting worse, all at the same time. And we've all seen how awful, we saw the extraordinary scourge of AIDS in Africa and in South Africa in particular, but we also saw the extraordinary rise of scientists. We saw that actually an enormous amount was done and learnt, and that's an incredibly powerful thing to remember, which is somehow we can do it. And, you know, as the young man in South Africa, our young scientist says, you know, we don't have to take crumbs from the rich man's table, actually. We should just do it ourselves. We don't have to do it. So that's really my huge takeaway from this was I started with feeling incredibly pessimistic. I am still very pessimistic about many, many things that are discussed in these films. I am incredibly pessimistic about the rich northern pharmaceutical companies ever changing. They won't. But there is a shift, and there's a huge shift in the global south, and God, that should be celebrated a lot. So I hope we gave a little bit of that sense of that, and that's it.
Brilliant. Thank you so much, Kat. Strong words again. I- I'm also really pleased that we're joined today by Peter Weber, another award-winning filmmaker, filmmaker, documentary director, and producer. His debut feature film was as director was The Girl with the Pearl Earring, and he's also worked on a number of films reflecting his commitment to environmental causes, including the award-winning environmental feature Earth One Amazing Day. And we've been really privileged to work with Peter as well as part of this filmmaking team. So Peter, please take the floor.
Good evening. Thank you. Kat, I was just going to respond to you. I think it's Gramsci who said pessimism of the intellect, optimism of the will. And I think that's a thing that anyone who's an activist, who is politically engaged, morally engaged, whatever you want to say, who cares, who gives a shit, is that we know that we're in a terrible position. We know that things are very difficult, and fighting back is hard, but it's important to do it nonetheless. So there we go. Pessimism of the intellect, optimism of the will. That's my watchword for this year. It's going to be impossible to follow all these stirring and amazing speeches. So I'm going to keep this short and simple. I just want to let some of the people who've joined us here understand a little bit about the ethos behind the way we made the films. Some years ago, to do a series of films like this, you would have picked up a director in London or New York and a producer and stuck them on a plane and flown them around the world at great expense, and they would have stayed in hotels and visited all these places and come back with a bunch of films that probably looked a little bit too much like commercials, but whose heart was in the right place. Once Kat invited me to collaborate with her, I mean, we were both very clear that that's not the way we were going to do it. We wanted to do it with the ethos and the spirit of the charitable organisations and the activists and the people who are actually going through this at the moment. So we came up with a scheme to use local filmmakers wherever we could to act as a central hub in London, to bring the rushes into and to put these films together, but they should be told about local people by local voices with local crews with as few flights as possible. And that's one of the things. New technology may plague us in many ways, but it can also be a liberatory thing, I think, as well. And I think these films show that. And it was indeed a great honor and joy to be able to get on the phone and kind of go, right, we need someone in Brazil. Who do I know? And yes, of course, there's a brother of my great friend, and he's a producer. He's in Mexico. He must know someone. And then we get the fantastic Laura Castro. So through these, both Kat and I love making films outside of the UK. We go to a lot of film festivals. We're very lucky in that way. So we have big phone books, and it was fantastic to be able to take those and put them to the use of a campaign like this, and make sure that we weren't being flown around the world to make a bunch of films, but rather we could empower some local filmmakers as well. So it's quite humbling to see them all put together. There's a lot of voices, obviously. They have to fulfill aesthetic criteria, political criteria, lobbying criteria. I mean, when you're putting together short films like this, there's obviously a lot of voices. There's the stakeholders, there's amazing campaigners like Sibongile. You have to be very true to people's real lived experience. And it was I can't say it was always a joy, but it was a great honor and a privilege to work on this. You know, there was some big ups and downs, as we know, to reach the position where they have now, where I think they're very simple and very strong. And seeing them together, you get a real kaleidoscope of exactly the problems we face around the world. So congratulations to the filmmakers and also to the participants and all of the people who were kind enough and strong enough to volunteer up their lived experience, because that's the most important thing. That cat and eye side of it, to be honest, is what we tried to do was to facilitate the voices of the local filmmakers, and most of all to facilitate airing these issues and finding a way to humanize them and make them emotional rather than just dry and statistical. So congratulations, everyone. Thanks for joining us and have a great evening. Thank you very much.
Thank you very much, Peter. Thank you all for some incredibly stirring speeches. I know there's a lot of people who've been asking questions in the chat now. We've been taking down some questions. If you have further questions that you'd like to ask to any of our panelists, please just pop them in the chat and we'll put them out. I think everybody's come here to listen to Sibongile, George, Laura, Kat today. But if you have questions that you would like Global Justice Now's representative me to answer, I can do that as well. Quite a lot of these questions are about the pharmaceutical system, obviously. Some of the technical details. I think we've had questions, including from Timothy Malone, asking, are we right to blame the pharmaceutical companies for their greed when we have established a world economic system that rewards profit? Is there a possibility, Chiran asks, that we can make these companies less greedy? Like how do we reform this system? And Timothy has asked again, why do we allow these companies to behave as businesses when health and life-saving services should be available to everybody free? So there's questions here about how do we reform the system? Is it possible? Do we blame the pharmaceutical companies themselves for their actions? If so, why? If not, why not? Yeah, I mean, I know there's plenty that our panelists will have to say about that. Sibongile, I can see that you're beginning to smile in response to some of those. Would you like to start?
Yes, Tim. We should always remember that pharmaceutical companies are here for saving lives. That's what they always claim. And they always say even when they start the research, all the research that is happening, it's done through saving lives. And that's exactly what they're supposed to do. And making so much profit out of people's misery, yes, we have to blame them. We have to hold them accountable. And hence, in my response on the chat, I'm saying they are as same as responsible as governments, because also governments allow them to continue to be greedy, and they are paying so much money to the government so that government can turn a blind eye on the serious issues. Like, for instance, what happened in COVID, when we were advocating for access to vaccines, especially from the global south. Pharmaceutical companies were using government from the global north to push back so that they can make profits. And that is not fair at the end of the day. So they have to take responsibility. We have to blame them. We have to blame them. That is why when we blame them, we don't leave our governments behind, because also they have the responsibility. Yes, we have economic growth, we have all these new developments, but all the time, health is the last thing they think about. all the time, people's lives are the last thing that they think about. And accept us as human beings, as people standing up for ourselves and say, we need medication. You cannot do this. Then there's no one else can do it. So we have to continue to fight. It's unfortunate because we are living in a world where we always vote for leaders or elect leaders, but these leaders are not there for us, are there for their pockets.
Thank you, Sibongile. I completely agree. The need for national and international struggle at the same time. I mean, I know, Laura, obviously you met some people who are doing things very differently, and they're backed by the Brazilian state, right? A state which has historically invested in public health in a way that perhaps, well, in a way that a lot of governments have. I think, George, you were saying as well that many of these medicines are developed with public funding, but then handed over to private pharmaceutical companies to make huge profits from them when they're privatized. But yeah, I guess there's a question there as well about, how do we build support for building these alternatives? I don't know if Laura or George, you'd like to come in on that.
Okay. How do we stop them? Yes, I have a comment on that. You know, like Kat said, it is getting better, but at the same time, it is getting worse. And so, what is there for us to do? We have to unite like we have never before and speak with a great voice across the universe. Let us not fold our hands and lie down and think there's nothing we can do or nothing will change. Something will change, but it wouldn't change until we get into action. And I can show you a typical example. Right now, you are aware that the WHO is working on a pandemic, how you call it, treaty. And very interestingly, the first time that treaty came out, it had nothing absolutely whatsoever about workers, as we call ourselves, trade unions, concerns. When it was brought to the floor, people read and saw some clauses that they felt were not just right, and workers and advocates from across the globe started to mount on Geneva every time the committee met to do some work. And before they would go the third, fourth times, there were about 3 concerns from the civil society organizations and trade unions and global advocacy groups that came into fold. Yes, that was a good start, but it didn't end there. People weren't still satisfied. They pushed and pushed and pushed and pushed. And every time they came back to meet, at least 1 or 2 were considered. Until now, I think more than 9 of the concerns that people raised at the initial stage have now been taken into consideration. That gives me a great hope that if we stand together and speak with one great voice, never giving up, we can reach a point where Big Pharma will change her attitude towards mankind. We need to push for them. They have to be responsible and they have to respect human rights and human dignity. So we must call them to book for that until they can respect our rights, until they can do what is right. Let us not give up. Thank you, comrades.
Thank you very much, Bill. That's just, again, really inspiring. I can see that someone's got a hand up in the chat that wants to ask a question. Let me just, sorry, my computer is not playing ball. If you've raised your hand, would you mind taking your hand down and then putting it back up again? I had a notification, but it's just disappeared. I know there was one person who wanted. Great. Demi, You should be able to talk now, Dimi. You might need to unmute your microphone though.
Okay, thank you very much for this opportunity. And my name is Dimi from Liberia, currently in somewhere other in Asia. So my contribution is to first of all thank you for the way you have organized this event. The brother who spoke, George, and I are from the same country. What is really that worries me a whole lot is that right now these bigger companies they are in agreement with the government. They are going around and tearing our forest and polluting our drinking waters. These forests are serve as a habitat for some of the agents or some of the causative agents of the disease that are parading within our community. These companies now take all of the profits, and when they are sick, they are able to afford treatment that is very costly for the local population. But the local population are left unattended, and the biggest thing that they can ever do for us, like in Liberia, is to make a contribution when somebody passed or somebody died. But the local people are not strong enough to stand the government, because each time the water is polluted, the drinking water is polluted, and they go to register their displeasure by putting up placard. The government then through the company they deploy security and then remove these people by force. I don't know how this strategy can help to bring a balance where the population that suffer most are also made to afford the cost of the medication. That I wanted to find out. I know that I may not be asking the way you would have thought, but in this kind of discussion, it's good to speak what is happening in your community so that your contribution can alleviate some of the misgiving that I have been having. Thank you.
Thanks, Dimi. Thanks very much. Could I just check your question at the end there? You were asking how people in communities affected by extractive corporate practices, which even sometimes bring up or cause more diseases to spread, how they can access affordable medicines. Is that right?
Yes, affordable. Yes, thank you. Yes.
Yeah. Okay.
Okay.
Would anyone like to take that one?
Maybe I can try to take it, Tim.
Sure.
You know, I want to make an example from what has just happened. I think here in South Africa, which is still the case. The case is still in court. The asbestos case. I'm not sure whether people have heard about it. Where in Free State, most of the houses have asbestos roof, and it causes illnesses to a lot of people, TB, most chest infections, and people are dying of that. And it is so unfortunate because the case, it's taking long. Up to today, we don't have results. And this is because of the corporate. They knew that asbestos in the long run will cause problems for communities, but they continue to use it. And it's so unfortunate that many houses that were built, I would say prior 1994 and early 1996 into nearly 2000, by government are still having asbestos as a roof, which might be harmful to communities. But because this is done by the government working with corporates, up to today, there's nothing that is happening, even though communities have stooped up, lodged cases, but even the court is taking long. So yeah, corporates, they need to be held responsible. And that is why in other conversations that we have as activists is to say, how do we hold a private sector accountable? How do we make sure that they are taxed and they pay back to communities for what they've done? We know we can make countless examples of climate change that is caused by big corporates. And today, communities are the ones who are struggling. Some of the disasters that we have are not natural, are caused by the harmful chemicals that they are using to make profits. And that is why in my speaking earlier, I was saying we need each other more. We need to unite. When I say we need to unite, I mean every activist, whether you are a health activist, environment, a financial activist, whatever activist that we have, we need to start working together now, because our struggle, if we continue to fight separately and we don't come up with one demands, we are not going to win this, because while we are trying to close the gap this side as health activists, the other challenges on the environment are coming up and people are dying at the end of the day, which doesn't assist, because if people are affected by our environment, then the health also is part of it. So we need all of us to come together. We need all of us to support each other. We need to educate and provide information to each other so that we can link our struggle, so that we can be able to win against this inhumanity that is happening globally, not even only in the global south, but globally it's happening, because people, governments are putting themselves first other than people's first. So they only care about them and their families, to say how do they sustain and build future for them. But how about the communities on the ground? We always suffer the consequences of a government's decision and all the businesses that are there. Thank you.
Thank you, Sibongile. And yeah, I think what you're saying as well is it seems to me that it's the intention of corporations to profiteer at the expense of people's health, at the expense of people's lives. It's almost more naked than ever now. This sort of pushback, whether against aid, whether in the huge pandemic inequality and the financial inequality that stem from it, it's more obvious than ever. They're not pretending. They're not pretending now to consider that they have people's interests at best heart. It's more obvious, and that has to be something that we're able to unite around as a movement, and to demonstrate that we must urgently organize for a very, very different system. Now, I'm aware, Sibongile, it's later in South Africa than it is here in the UK, and I want to let you go to bed soon. Do you have time if we do a short round of questions? If anyone has time, maybe two more questions, and then we can let you go. Or if you have to go, you're obviously
maybe I can give 5 minutes, because
yeah, sure, of course.
it's 9 o'clock here.
Yeah.
And I just came from airport to here. I didn't have time to go home, and I still have to do some things. So I can give you 5 minutes if there are some questions. I'm happy to stay for 5 minutes, and then I will have to leave.
Okay, well, if there are any more questions, anyone would like to raise their hand, then please ask now. I suppose one question that's come from the chat is again on the theme of optimism. How do we make sure that more of these initiatives spread, like the mRNA hub? Like, how do we make sure that more of these positive examples spread? How do we get them to other countries around the world? What does that look like? Is that a struggle that we have to do in each nation? Is it about what coalitions do we have to build? How do we make that happen? I'd be interested in. Sibongile, if that's something that you'd be happy to answer, I may throw it back to you and then offer it to other people, and then we can allow you to leave.
I think, as I've said, we need each other. We need each other more than ever now. We need to work together. We need to link and align our struggles, and we need people on the ground. We are, we understand that people are tired. People are tired of fighting. People are exhausted, and people have lost hope. But at the end of the day, we need to do something. Someone needs to spark something there. Because when we are going, like for instance, I will make another example about us here in South Africa. We are going through a lot as communities. There are a lot of challenges: electricity, water, climate change, health, violence, crime. So you end up not knowing what to do, what to fight. And people started to accept everything that is wrong as a norm. They started to accept, to say it's okay. It's okay to go to bed hungry. It's okay to die, and it's okay to live in an informal settlement. It's something that, and now it's starting to be normalized, which that is not how people have to live. That is not something that we can normalize it. And it's so painful that our space as activists, it's infiltrated by fake activists who are trying to dilute the space and the activism. And sometimes we are often oppressed, and we are unable to speak out because we are, especially with the issue of funding, we are silenced because of funding. What is really happening here in South Africa? Most of organizations that are affected by PEPFAR cut funding are scared to speak out, just in case a PEPFAR funding comes back. And we know for the fact that it might not come back. But even us who are speaking against our own government, we are always questioned to say, are you speaking as the leader, as the chairperson of the organization, or are you speaking your views as an individual? So you always have to protect yourself and protect the organization. And so your right to speak, your right to raise your voice, your right to fight, it's often oppressed because you are vulnerable. So for us, sometimes some of the activists are unable to speak out, not because they don't have a voice, but because they are scared, because they'll lose funding, because they'll be asked questions. They'll be questioned to say, why are you speaking about this? Why are you saying this? Why? But we should stop being scared. We need to be brave. We fought for our lives. We spoke about it differently. We all made means to be where we are today. I never thought by 2025 I'll be still alive. But here I am, I'm still alive. Not because of my effort, because of other people's effort and the joint efforts from different parts of sectors and different parts of the world. We were supported by other countries to be where we are. We managed to smuggle treatment from Thailand to South Africa so that we can show our government that this treatment is there, it's working for us, and we can survive. So if we did that time, I think we can still do it today. We can still fight together. We can still work together. Those who still have, who are not scared to raise their voice, let us do it for those who are scared.
Brilliant. Thank you so much, Sibongile. Incredible words.
And I'll have to leave you now.
Thank you so much for joining us tonight.
Thank you.
Thank you. I think I would like to offer the chance to George, Laura, and Kat to add any final words to close tonight. George, I can see you're ready to speak.
Thank you. So going forward, linking what Damien asked and the last question on the floor, on the optimistic, I think like what my colleague had just said, in addition to that, this unity we are calling for, it has to be realized that we are talking about global solidarity, so that in the case of what Dimi had described in Liberia, where there are multinationals who are violating the rights of the locals, and governments are conniving with them in bringing the security, brutal security. In some instances, peaceful demonstrations end up in the loss of lives of innocent people. When there is a global solidarity, we can trace the company that is violating the rights of Liberians, link it to a country like, say, the UK. It's a ATM terminal that is from the Netherlands. And we know in their own countries, they have very decent laws. That even though they are operating in Liberia, in some part of Africa, those laws, they are still answerable to in their own countries. And by the solidarity we derive from our comrades in those countries, we can pick up an issue, and they can help us to rally around their governments to make sure that their national companies that are outside and violating people's rights will conform to their own laws in their countries. In going forward, we need to never give up, like my comrade said. There are times when it gets so tough, but there is this saying that winners never quit, but quitters never win. And so no matter how it be, we should stand up for what is right, and let us continue to engage each other, sharing information. You see, like Peter just told us how these films were developed. Instead of getting one person from across one continent going across the whole world, everywhere there were people you could use, there were people you could speak to, you inform them, and you use them to do what was necessary. In the same way we can do when we have global solidarity and sharing information, what is happening in Brazil, people in South Africa can learn from their success story and apply it and see if it works, or in their own local context. But also helping the issues, like I said, connecting the dots to see the root causes where they are from, and trying to handle them from that level, we can still win this battle. So let us not give up. I think we should keep our hopes alive and put our hearts together to remain one body in the struggle. Thank you, comrades.
Thank you very much, George. Kat, would you like to say any final words? No, sure. Laura.
Yes, very briefly. I've learned a lot today here, and I think the beauty of this project is that it's called two words, and yet we are all here together thinking one word and how to keep hope and how to make changes. And I think Brazil has a unique story if we think about health, public politics. We have a strong health public system since the early 2000s with the first Lula government, but it was very much threatened by Bolsonaro's government. But it's an example of an institution that can work, of a political program that can work, that we can share technology. But we don't know if they come back again in next election or in the coup, like they tried to do last January, or last year's January, if how much they could destroy of this. And if we think about environment, we are now in a big crisis here because they are destroying Amazonia. And for instance, inside Brazil, there is a big political fight about that. But not only when Trump cuts the fundings for organizations that care for our environment here in Amazonia, it's very fast that we can destroy everything. And if we destroy Amazonia, we destroy the whole world easily. And so it's one word. And when we get together, even in the meeting like this, thinking about this all together, it feels hope. And we must share our experiences and our fights and our hard times to think how to do it. Some of the questions were, how do we solve this? How do we solve this? I would be very glad if we actually knew. But thinking together is a way. So I'm very glad to be here. And also, thank you so much to be part of this project. As a filmmaker, I'm very honored to be here with Kat Villers, Peter Weber's U team. It's a great honor. Thank you very much.
Thank you so much, Laura. And for ending on that note of hope as well. And again, to be here with everybody, and to see all the messages in the chat today, the conviction and the courage that I've seen from everybody, it gives me energy, and it's been really, the whole project has been wonderful to get to know people who are doing such incredible things, and to work with brilliant creatives. And yeah, I hope it's been as galvanizing for everybody here as it has been for me. Global Justice now is continuing to campaign on corporate power, and to push for a fairer pharmaceutical system. We want to get as many people as possible to see these films, so please do share them on social media. There's links right now in the chat, and we will follow up over email as well to share some of this. But yeah, we just want to get this message out there as far and wide, and get as many people to see these films as we can. I want to thank all of our panelists again today for joining us: George Williams, Laura Castro, Sibongile Tshabalala, Kat Villiers, and Peter Weber, and Laura Castro. If I haven't said your name already, sorry. It's my brain is fading. And yeah, I hope that we'll campaign together again in the near future. If you want to use these films to put on a screening, just get in touch with if you're already a Global Justice Now member, then reach out to Guy who runs the activism team, and I'm going to put my email address in the chat here as well, and you can send me an email and we'll share a flash drive with you so that you can organize your own screening. We've got posters, and we can support you to put that on as well. So yeah, if you would like to put on a screening, let us know, and we'd be really, really pleased to support you and provide a speaker as well. Thank you very much, everybody. And I hope we'll all speak again soon. Have a good evening.